Matthew Holt with the Healthcare Blog. I'm here with Kota Kubo. He's the CEO of Ubie, which is a leading Japanese symptom checker, but much more. So we met in 2018, I think, at Health 2.0 Japan. And a few years later now, you guys have really progressed. So tell us a little bit about your symptom checker, and we're going to have a demo in a second. Tell me a little bit about the symptom checker.
Yes, thank you very much. Yeah, I'm Kota. Yes, thank you for having me today. And our symptom checker is using the AI data from getting the data from the medical papers and also their real clinical field, because we have the healthcare providers clients in Japan more than the 1,500, so that we can get the real clinical field data that train AI. And also the AI's accuracy of the disease prediction can be improved that data. And we provide this service over the 7 million monthly active users, including Japan, also in the US.
All right, fantastic. So it's come a long way. 7 million active users is a lot of people in Japan. The population is only, only 110 million, I think, Japan, 120 million. But and obviously, and you've been doing this in Japan since 2017?
2017, but we just the early days of our business, we focused on the healthcare provider side of business, so that we just launched this B2C service just to 2020.
Okay, so quite recent, and then just launched in the US this 2022.
2022, yes.
Okay,
yes,
so just getting in. So actually, have a lot of active users, considering you're not here that long. So there are a lot of symptom checkers. What makes, we're going to have a demo in a second, but what do you think makes Ubie different and better than other symptom checkers?
Great question. So at first, as you mentioned, we have the original data from the such as directly coming from the real clinical field, because our AI suggests a disease name to the doctors in our product. And also the doctors input their actual diagnosis to our platform, so that we can train the AI. So as a result, our accuracy of the disease prediction is very high. And the second point is we are focusing on our business model based on the pharmaceutical companies. It's one of the different points. And also we have conducted more than 100 projects with the pharmaceutical companies. And also we have partnered with more than 30 pharmaceutical companies.
And that's to identify primarily rare disease patients and help them get extra services from the pharmaceutical companies.
Exactly.
Fantastic. All right, brilliant. Look, you've got up the thing. I'm going to move it a little bit closer around you here. So why don't you show me a bit about what the product looks like?
Sure. This is the AI symptom checker launched in the US market.
Okay.
So in this symptom checker, there are several questions for the users. And in the front, so the people select their sex, and also the age, and past medical history. And after that, they select their symptoms, like a headache, something. It's the main symptom. And there are several symptoms in terms of the related to the headache itself.
Yep.
Sorry. And the duration.
Yeah, I get the pain like an electric shock quite a lot. I'll have to go use it. So you're collecting a lot of different symptom, connections and conditions later into this one. Yep. And you're telling them also how many questions they have left, right? So just one question left, so they don't think this is going to go on forever. How long is the average interview?
Sorry.
How long is the average time that someone spends on screen?
Three to 5 minutes.
Okay, so 3 to 5 minutes, and then
Yes.
and then you give them the report. Okay.
And in the summary, there is a triage level. It's not so the urgent one right now. And also there is a possible causes in terms of the disease.
So you're
Like
saying
it's a
this,
very mild one, actually.
this person just has a cold. Right? They probably knew that already, right? But you have a various different levels. You said so. One of them might be going to see a doctor, right?
Mm-hmm.
And then you've had how many people have gone to Ubie and had the same thing, and then what other differential diagnosis it could be, right?
Yes, exactly.
Fantastic. All right. So, and at that point, does the user experience kind of stop at this point? Do they kind of stop there, or what happens next?
Oh, at the next, so that we can guide people to the appropriate care with this disease suggestion and also the action suggestion. And sometimes it's a mild disease, but sometimes we provide more deeper information, like which healthcare providers are.
Okay, so you have like an action step or a thing next to it. That's fantastic. So, as you said, this is being used now by, you had said 7 million people. More in Japan, I assume, than in the US, because it's been in Japan a bit longer.
Mm-hmm. Yes. Right.
Is there a difference? I mean, the technology is a technology with the Bayesian logic, and is there a difference really between doing it in Japanese and English?
Mm-hmm. A great question. So they basically we use the same data, but we tweak the data to the different one, especially for the disease prevalence.
Okay, so I mean, there's obviously difference in disease prevalence, but essentially, once you've figured out the underlying logic of how to do the symptom checking, it could work in any language, but there's some tweaks for that.
Exactly. We are now planning to expand our language from the English to the other language like Spanish or Chinese. Or
Okay, so it's going, but right now it's been Japanese and English. Fantastic. So on the business side, you said you're working with pharmaceutical companies. They are paying you to help. What is the proposition for them? Why do they care? Obviously, you can sort of identify these rare disease patients or patients who might be of interest to them. But what is the actual mechanism by which you are connecting with the patient? You know who the patients are. The pharmaceutical companies do not know. But how are you actually? Why are they coming to Ubie?
Yeah, great question. So first of all, we can guide people to the appropriate medication. So that as a result, pharmaceutical companies appropriately increase their amount of the prescription, especially for the rare disease and the specialty disease. So it's our value proposition, and using our platform, so we can see the data of which patient go to see a doctor or not, and also which patient gets which prescription drugs. So that we can suggest people with some actions and recommend their doctors, and after that we can get the data from the patient because we are providing the survey to them, so that the pharmaceutical companies can get to know how many patients can be guided by us, so that we provide we provide a report to the pharmaceutical companies, and they get to know the ROI of that project.
Fantastic. So basically, because you have registered at the point where someone gets a report, they might register with you. With those people, you can now survey them. Presumably, you can send them, coupons or suggestions to go to patient assistance programs or whatever might happen to be the relevant thing. I don't know if you're doing clinical trial recruiting or anything like that yet. But I assume that those patients are obviously very valuable, and if you can help them and steer them around, there's a lot of interest from pharma companies and others about that. Brilliant. So last thing, tell me briefly about you raised, I think, $27 million, $28 million, something like that, a few years ago.
Mm-hmm. Oh, yes.
Was that with the intention of moving to the US or expanding the product to the US?
Yeah, so after raising their money, so that's our one of their biggest objective is to expand our service globally.
Yeah.
So that's the first target is the US. Actually, the first thing is the pain point of the pharmaceutical companies is very huge in the US market, and also they more compared to Japan. So in Japan, the pharmaceutical company don't do their patient marketing. It's illegal in Japan. but in the US, so there is a huge amount of the advertisement cost of
Sure.
that. But in Japan, we can provide pharmaceutical companies with such a promotion service, and also it was very successful. So that's and we can get to know how we can make them success, so that we can just adjust it to the U.S. market, and also it's a very big potential from our business perspective as well.
Presumably, you can help them increase the ROI of how they're advertising, because most of that money is wasted at the moment. We spend far too much money advertising to people who don't care. So I think that's a great place. Fantastic. Well, I've been talking with Kota Kubo. He is the CEO of Ubie, and good luck with the expansion to the US.
Thank you very much.